Hello everyone. As we started the review on herbal lozenges that we made by our group under the guidance of Manisha Vidyanan, Department of Pharmacognosy, with my group members Harshali, Monica, and Darshan. So we start from the contents. Like in that content, first is introduction, second is methodology, third one is formulation examples, fourth one is marketed formulations, fifth one is conclusion. After that, we have introduction. In that introductions, there are lozenges are solid preparations that contain one or more medicaments, usually in a flavored sweet and base that are intended to dissolve or disintegrate in mouth. This is basically the definition of lozenges. That is, lozenges uh, are solid and flavored medicated dosage forms intended to be served and held in mouth or pharynx. After that, they are used for patients who cannot swallow solid oral dosage forms and well medications designed it to be released slowly toward a constant level of drug in oral cavity to base the through tissue in solution of drug depending on types of lesions as described by molding or by compression. Molded lozenges are called pastilles, while compressed lozenges are called pouches. That means uh, this happens in case of children's and geriatric patients most likely because they are having a difficulty in swallowing solid dosage forms such as tablet. Lozenges are compression molded, that is that known as the pastilles, and other one is compressed lozenges which are known as pouches. The examples of the pastilles are Mentos, mint, and the examples of the pouches are uh, clotrimazole pouches. After that, we're having the advantages of the lozenges. First one is it is easy to administer to both pediatrics and geriatric patients. Second one is a systemic adoption of drug is possible through cavity because lozenges dissolve in mouth, so the drug is absorbed to the systemic circulation through the saliva. After that, drugs having large dose can be easily administered in formulations such as lozenges. After that, contact time of drug with oral mucosa is more first pass metabolism bypass. In that case, means in the lozenges, we can avoid first pass metabolism because drug absorbed through directly from the saliva or mucosa. The first pass metabolism, uh, this is happen in tablet format. This is the advantage of lozenges over the tablet. After that, we are having the disadvantages. In the disadvantages, first one is it should be mistakenly used as candy by children. Second one is parent should be cautioned not to associate it. Third one is medications with candy and keep the product of the reach of the children. Fourth one is some drugs may not be suitable with worldwide candy based example benzocaine because the benzocaine causes loss of feeling on skin, and benzocaine are the local anesthetics causes the life threatening conditions. After that, we're having the types of lozenges. In the types of lozenges, we are having the local effect lozenges and systemic effect lozenges. In the systemic local effect lozenges, first one is antiseptic and second one is decongestant. In decongestant, we are having the Vicks, and second systemic lozenges, we are having the vitamins and nicotine examples. Second one is according to the texture and composition. In that type, there are four types of the lozenges. First one is a chewable lozenges. Second one is a compressed tablet lozenges. Third one is a soft lozenges. Fourth one is a hard lozenges. Okay. And after the
Hello everyone, my name is Pinnar Harshali. My topic is according to texture and composition. First, chewable lozenges. These lozenges specially used for pediatric patients and are very effective means of administrated during medications of gastrointestinal absorption. Chewable lozenges are intended to treat local irritations or infections of mouth and may also be used for the systemic drug absorption. Manufacturing process of chewable tablet. First, the candy base placed in beaker and Milton on warm water bath. Second, mass is allowed to cool toward 120 degrees Celsius. This is followed by addition of active ingredients. Third, medicament then added between 95 to 105 degrees Celsius. And last one, crystals and flavors are added below 285 degrees Celsius, followed by lubrication addition about 80 degrees Celsius. Candies are there formed by row forming. Next, candy base placed on warm water bath, then cool to 120 degrees Celsius. Addition of the ingredients or medicaments at 95 to 105 degrees Celsius, then crystal and flavors added at 85 degrees Celsius, and then add lubricants at 80 degrees Celsius, and the candies are formed by row forming. Next, second, compressed tablet lozenges. A pharmaceutical tablet formed by subjecting dry granular powder to sufficient pressure to make the particles coagulate. This is the powder sweetness that is either compressed into a tablet or held together by a binder to make a lozenge candy. Depending on the nature, the sweetness used. A tablet formulation may also include a binders to hold the particles together prior to compression. Manufacturing process of tablet lozenges. First, manufacturing compression ingredients are thoroughly mixed. Then, manufacturing of compressed tablet lozenges can either be direct compression and weight granulation. Second, indirect compression ingredients are thoroughly mixed and then compressed in weight granulation. Sugar content is pulverized by mechanical combination to find a powder 40 to 80 mesh. Third, medicament is added, thoroughly blended mass is subjected to granulation with sugar or corn syrup and screened through 2 to 8 mesh. Fourth, this is formed by drilling or milling 10 to 30 made size flavor and lubricants are then added prior to compression. Drilling means cuts into a surface vertically and milling is only done with a milling machine. Next, next, third, soft lozenges. They have become popular because of ease of extemporaneous preparation and application to a wide variety of drugs. Manufacturing of soft lozenges. First, on amount of soft texture of these lozenges, they can be hard rolled and then cut into small pieces, or the warm mass can be poured into a plastic mold. Second, mold cavity should be overfilled if PEG is used as PEG's contract as then as this cool. This is not required in case of chocolate as it does not shrink. Next, ingredients and lozenges cut into pieces and warmed, then poured into plastic mold mold cavities overfilling, then drying and lozenges are formed. And last one, hard lozenges. Next, hard lozenges are mixture of sugar and other carbohydrates in amorphous on glassy state. They can also be regarded as solid syrup of sugar, then moisture content and weight of hard candies lozenges should be between 0.5 to 1.5% and 1.5 to 4.5 grams. Manufacturing process of hard lozenges. Next, combine sugar, corn syrup, and water by heating, then addition of the medicament to this candy matrix, and then addition of polymers, flavors, color, etc., and then flow forward into mold of design, shape, and size to forming a candy. The next point will continue Darshan Chand.
Hi, this is Darshan Chand and
Uh,
my top methodology of lozenges. Methodology is nothing but it is a type of procedure we follow to make formulation of lozenges. Soft lozenges were prepared by melting and mold techniques. Base was melted on water bath and mixed with other ingredients powders to form was bought into stainless steel mold. Next. Now here we are provided with the table which is required for the formulation, and it contains ingredients, quantity given and quantity taken. So first ingredient which is necessary for formulation is piperine. It contains bioactive compound, and quantity given is 2% and quantity taken is 0.2%. The next ingredient is geraniol. It has a pleasant odor and it is used as a natural pest, and it is also given in 2% and quantity taken is 0.2%. And next is gelatin. Gelatin is usually used for weight loss, which is given in 14% and quantity taken is 1.4%. And the last is glycerin. Glycerin is used to moisturize to prevent dry and rough itchy skin, which is given in quantity of 35% and taken in 3.5. Next slide. Now here we are provided with the table of hard lozenges for 30 ml of hard lozenges, and we required a drug of 1 gram, and we also required powder sugar, corn syrup of 16 gram, water 24 ml, mint extract 1.2 ml, and we required a color with quantity sufficient. Next. Soft lozenges. Soft lozenges can be manufactured by molding method. Hence, and the drug here for 10 lozenges, the drug given is 1 gram. Polyethylene glycol is given as 10 gram. Aspartame is given as 20 gram. Mint extract is 1 ml, and the color is given as quantity sufficient. Next. So next is chewable lozenges. Chewable lozenges is one that is palatable and that may be chewed and ingested with little water. So what are the ingredients required in chewable lozenges? The ingredients required in chewable lozenges are glycerin, gelatin, water, flavoring oil, methyl paraben color, which are in glycerin we need 70 ml, gelatin 18 gram, 12 ml, 0.4 gram, flavoring oil we need 3 to 4 drops, and color quantity sufficient. Next. Now, next is formulation of lozenges. Now, here we are having candy base. Candy base contains sugar, sugar-free vehicle, and filters. The example of sugar are dextrose, sucrose, etc. Example of sugar-free vehicles are mannitol, sorbitol, etc. And fillets are Dr. Calcium phosphate, calcium sulfate, etc. And the next is lubricant. Lubricant is used for reducing the friction. And the example of lubricant are magnesium stearate, calcium stearate, stearic acid, vegetable oil, and fats. Binders are the most essential element in the formulation of lozenges, and the example of binders are acacia, corn syrup, sugar syrups, gelatin, etc. Coloring agent, it generally provide colors, and it gives a characteristic to a tablet. Example are water soluble and dyes, FD&C color, orange color paste, red color cubes, etc. Next is flavoring agent, which examples of flavoring agent are menthol, eucalyptus oil, cherry flavor, etc. Whipping agent. Whipping agent essentially comprises of protein, milk, eggs, gelatin, etc. Humectants. Humectants. Example of humectants are glycerin, propylene, glycol, and sorbitol. Next slide. So the marketed preparation of lozenges, diflam. The generic name of diflam is benzocaine, and the uses of diflam is anti-inflammatory. Anti-inflammatory means it is a drug or substance that reduces, relieves swelling, pain, itchiness, etc. And it is marketed by Antrolles company. The next is strepsil. Strepsil, it is used to relieve discomfort which is caused by mouth and throat infection, and it contains dichlorobenzyl alcohol and amyl methacetrol. As you can see in the indication, it is useful in sore throat and blocked nose, and is marketed by Reckitt Benckiser. And the third is nicotine. It is used. It is a tablet which is usually flavored, which dissolves slowly in mouth, and it is used to quit smoking. And it is marketed by Perigo company. Next. Next is our herbal preparation. We are having products such as Capisol. Their indication is sore throat, and it is marketed by Com Incorporated. Next is our Coughlette. Coughlette, it is beneficial in both productive and dry cough and alternative cough, quickly relative, and it is mostly presented or marketed by Himalaya Herbal Healthcare. Direction of use for Coughlette is 3 to 4 times a day, as directed by the physician. Third is lockets. It contains menthol, eucalyptus, and vitamin C. Ingredients in lockets are glycerol, honey, citric acid, and it is indicated to use as for nasal congestion, sore throat, and it is marketed by Himalaya Herbal Healthcare. Next is swelling. It is used in influenza, bronchitis, sore throat, marketed by Hamdard Laboratories. And the last is Vicks, which is most common, used to relieve cough. It smooths sore throat, one dissolves in mouth, it clears the blocked nose, and is marketed by Procter and Gamble. And the further topic will be covered by Monica Bhoir.
Hello everyone, myself Monica Bhoir, and we are turns towards the evaluation parameters of herbal lozenges. There are evaluation parameters of herbal lozenges are microscopical evaluation, stability, physical testing are the evaluation parameters of herbal lozenges. Then we are seeing brief. Micro Microscopical evaluation is done for the color order test. Microscopical evaluation. There are five terms: determination of ash value, swelling index determination, thin layer chromatography, UV spectroscopy, moisture content analysis, shape. Next, determination of ash value. What is determination of ash value? Total ash method is designed to measure the total amount of material remaining after ignition. This includes both physiological ash, which derive from a plant itself, known as physiological ash, which is reduced of extraneous matter. Example: sand soil. Procedure: uh, weigh accurately about 3 grams of powder drug silica. Crucible initiate the powdered drug by increasing the heat gradually until the sample from carbon, and cool it. Keep it in a desiccators where the ash calculated percentage of total ash contrast to air dried sample. Next, this is muffle furnace. Muffle furnace is used for the ash value determination. The muffle furnace are available as a gas furnace, oil furnace, electric furnace, and modulatic furnace. Muffle furnace include housing, exhaust air outlet, furnace chamber, flap door, heating element, refractory brick, air inlet. These are the parts of muffle furnace. Next, second one is swelling index determination. 1 gram of herbal material plus addition of water or swelling agent. Example: swelling agent CMC, microcrystalline cellulose, starch, carboxymethylated starch. Third one is thin layer chromatography, valuable for a qualitative determination of small amount of impurities, easy to perform. Equipment are inexpensive, used for evaluating herbal material and their preparation. Next, one is the UV spectroscopy. UV visible spectrophometry analysis provide both qualitative and quantitative analysis, but markers are needed for a quantitative analysis. An attempt is made to study UV visible spectrometric analysis of some herbal raw materials for understanding qualitative and quantitative parameters without markers. Next, fifth one is moisture content analysis. Gravimetric method weigh 1 gram of sample and noted as its initial weight. It is placed in a vacuum oven at 60 to 70 degrees Celsius for a 12 to 16 hours. After specified intervals of time, once again the sample and moisture content can be calculated using moisture content is equal to initial weight minus final weight. Next is stability. There is uh, there is 1 to 2 months at 60 degrees Celsius, 3 to 6 months at 45 degrees Celsius, 9 to 12 months at 37 degrees Celsius, 36 to 60 months at 25 degrees Celsius. Then physical testing. Physical testing in which hardness determined by Monsanto hardness tester. Diameter is determined by the vernier caliper. Weight variation is 20 lozenges are average weight is determined individual weight is compressed to average weight. Next, here conclusion and result. Herbal lozenges are medicated confection designed for a local as well as systemic therapy. Wide range of activities can be incorporated within their structure. Most of the preparations are available as a OTC product and are very economic dosage forms. These have been developed about 23rd century ago, and still under a commercial production. Lozenges are enjoy an important position in a pharmacy and will continue to remain the same. The formulations of lozenges uh, is an easy and time saving process. It is an formulation which is more organoleptically accepted, particularly by the pediatric patient. Medicated lozenges will be ideal dosage form for a pediatric patient. This will have additional advantages of patient compliance, convenience, and comfortness for a efficient treatment, including low dose immediate onset of action, reduce regimen, and economic. This will offer better innovative dosage form. Next, here we are completed our topic.
So we are really thankful to all the people who gave responses and their precious time and coordination. A huge thank you to our guide who guided us to do this project um, and help us whenever we need it. Thank you so much.